Dr. Ming. I'm a family physician here in Thornhill, and I've been in practice since 2012, and I've been here setting up a practice over the last 2.5 years. So I'm concerned about the recent cuts that have been made in the media and kind of publicized about physicians. This is literally the third cut since 2012, and we've had multiple actually cuts since then. And it's really degrading our care, and I'm concerned about its effects on healthcare. So what's happening is over the last 2 years, we've had the equivalent of about a 7% cut through the ministry, and we've been hit with what's called a hard cap, where the government actually asks us to pay back money over a set amount that they're willing to pay. And what this is doing is it's caused a lot of new grads not to settle down in Thornhill, my neighborhood here, and a lot of other docs that were considering retiring have actually quit or retired. And it's really affected the practicing physicians and also the public. My registrations for new patients has increased 400% in the last 6 months compared to the 2 years prior to that. And it's causing a lot of burnout in both myself and my colleagues. We're working 60, 70 hours a week. We're doing paperwork after our kids go to sleep. I'm awake until about 12 a.m. most nights of the week, trying to catch up on all of the paperwork and the visits from during the day. And it doesn't help when the government demonizes us in the public. They talk about our pay and try to manipulate you guys, the public, into creating tensions with class warfare and jealousy. The fees that they're quoting aren't what we actually take home. For instance, with this clinic, we have to pay for rent. The software that we use to type in all the information in our visits with the public are hundreds of dollars a month. We have to pay for our receptionists, our lab techs and nurses, and all of our supplies. Even this paper, the exam paper, costs money, and we're barely taking home any of the money that we're being paid with. And the government has also quoted that physician income has increased 61% in the last 10 years. This is on top of a 20% increase in physicians, 26% increase in inflation over the same period, and also 1.3 million extra Ontarians. So we're not actually being paid more because we're getting raises. We're being paid more because we're forced to work harder. And with these cuts, a lot of physicians are going to be leaving the province, and the remaining ones, like myself, who don't want to leave and care about our patients, are being forced to work until we're burnt out. And this is silently, slowly happening to the province's healthcare system, and it won't be noticed until it's too late. And I hope that by you guys seeing what's happening here, you'll actually support us in letting the public know, and letting your MPPs and your members of parliament know that this is not fair for the public in terms of having their healthcare being dismantled, as well as unfair for us as physicians trying to work our best to care for you guys, but being attacked from all angles, from the government, who's trying to just care about their finances and not care about what's happening to Ontarians across the province. So think about the last time you've had to interact with physicians or the healthcare system. When was the last time you had to wait for hours and hours to see a family doctor or a walk-in doctor, or to see an emergency physician? When was the last time you had to wait months and months to see a specialist? So every single one of these things is dependent on the supply of physicians in Ontario, and with these cuts, every single one of those is going to get worse. You're going to end up seeing your doctor after prolonged waits of 2 weeks, 3 weeks, or 4 weeks. You may show up in clinic and still have to wait hours, and the visits may get shorter because we're all being flooded with patients that are being orphaned from docs that are disillusioned and leaving the province. Again, my current volume has increased 400% in the last 6 months compared to years previously, and this is going to happen to all physicians in Ontario, and as well as specialists. So the 1 or 2 month waits may become 3 to 4 months, 5 to 6 months, and in certain cases up to a year. So these are all going to get worse with these cuts if the healthcare system is being dismantled as it has been by the Wynne government. So what the provincial government has done is they've walked away from the negotiation table and they've implemented by force their conditions. We are different from other professions in that we cannot make our money in any other way. By law, we can't bill private insurance, we can't bill directly, and we can only get our funding from the government. And if they're able to just legislate whatever they want, we have no recourse. So we're being portrayed as being fat cats, elitists in the public, but in reality, what the government is doing is manipulating the public into looking just at untruthful numbers and manipulating them to feel jealousy and to implement class warfare to manipulate everybody against physicians. But we're not the enemy. If you lose physicians, you lose healthcare, and this is going to take decades to build up. If you are as concerned as I am about our healthcare system, I hope you can share this message with your friends and family, and to contact your local politician, your MPPs, and express your concerns. The only way this is going to get addressed is if we fight this together.